I'm going to talk about insulin. I'm going to talk about types of insulin, what kind you want to give, and when you want to give it. So, there are a few basic types of insulin, and the main difference between them is how fast they act and how long they stay in your system. And the reason there are different kinds is because they're designed to deal with different things. Some insulins are designed to deal with exogenous sugars, that is to say, sugars you put in your mouth or into your veins, um, that is to say, your meals. Other types of insulin are designed to deal with the sugars you make through, breakdown of glycogen, etc. As you go through your day, the sugars that your body makes to meet your basic metabolic needs. So I'll get into what that means in a little bit, but I'll start by talking about the different kinds of insulin. For now, it's important to know that there are different kinds, and the main difference how is how fast they act and how long they act. So the first kind of insulin is your rapid insulins, and those are things like Humalog or like Pedra, and they tend to start working really quickly, between 15 and 30 minutes. And they'll peak around 1 hour. And they'll stay in your system for about 4 hours in total. So you can imagine that's pretty useful for meals. So you'll take it around mealtime, it'll peak at an hour, and then it'll be gone by 4. Now, your second kind of insulin is what's known as your basal insulins. That is, say, insulins that stay in your system for a long time. And those are divided into two kinds. One is called the intermediates. And those are things like NPH, or what used to be called lente insulin. Those will start working 1 to 2 hours after you take them. They'll peak somewhere between 4 and 12 hours, some maybe around 8, and they'll stay in your system for somewhere between 12 and 18 hours, although their activity will be greatly diminished. Realistically, what that means is patients who are on things like NPH will take it usually twice a day. Effectively, it seems to last for about 12 hours. And the problem there is that they do have a bit of a peak. So you might need a bit more sugar around when they peak. So you have to sort of take their effect into account when you're eating. You don't have to take into account the effect of the true basals. Those are things like Lantus or Detamir. Those are those are insulins that are designed to stay in your system and match your endogenous insulin, your endogenous sugar production. Replace the low level of insulin that you've always got in your system if you don't have diabetes to match the small amount of sugar you're always making. Those are things like Lantus and Detamir, and they'll start working 1 to 2 hours after you take them. And what's neat about them is they have no peak at all. So so you'll take it, they'll start working 1 to 2 hours, and then they'll stay working at a constant rate for the rest of the day. So what does that mean in terms of a diabetic patient who's taking insulin? Well, what it means is that most patients with diabetes will take insulin about 4 times a day. At breakfast, at lunch, at dinner, and at night before bed. What do they take? Well, it makes sense that around meal times they'll take some rapid insulin uh, because you'll take it right before you eat, say right before breakfast. It'll start to work just as you're eating breakfast, as you've got the food in your mouth. It'll peak as you're metabolizing the sugars, and it'll be gone when it's time for your next meal, when it's time for lunch. So lunch, same thing. You take the insulin, you take your sugar, they peak in your bloodstream at the same time, and it's gone by dinner. And then the same thing happens at dinner. So what about nighttime? Well, nighttime's when patients tend to take their basal insulin. So they'll take a low level of basal insulin, and that'll last for the rest of the day. So let's talk about what that means in terms of, say, your patients in hospital. What about a patient who's NPO, a patient who's not eating any food? Are they going to get any insulin? The answer is yes. They are going to get their basal insulin. Their basal insulin is what will meet their endogenous insulin production, the amount of sugar that they've still got floating around in their bloodstream. Now, their rapid, you are going to hold if they're not eating. Because, of course, that is insulin you give to match what they eat. So what are some sample orders going to look like? Well, you'll write basal orders You'll write basal orders for every day, and you'll write rapid orders if patient is eating. I'm going to talk about how to calculate how much insulin to give, and then we'll put it all together. Let's say you've got a patient who comes in and the notice on blood work they've got an A1C of 9%, high enough to start insulin. So they're going to need insulin 4 times a day with 3 meals a day, and 1 bolus. How do you calculate how much insulin they need? Well, we start with weight-based calculations. Let's calculate a total daily dose. As a rule of thumb, your starting total daily dose is equal to your body weight in kilograms times 0.5. So, for say our average, let's say 80 kilogram man, he'll probably need about 40 units of insulin to start. And then we further divide that. Half of that is going to be basal, and half of that is going to be bolus. In our case, that translates to 20 units of basal and 20 units of bolus. And we'll further divide that bolus into 3. Let's say 6 units at breakfast, 6 units at lunch, and 6 units at dinner. So, what orders are we going to write? For our 80 kilogram man, we'll probably write orders like this. We'll pick a basal, say Lantus, 20 units, sub-Q, QHS. We'll write an order for some rapid. Say Humalog, 6 units with meals. If patient is eating. And notice what I did. Notice the difference. Lantus, our basal, we're going to give no matter what, because that matches our patient's basic metabolic requirements. The Humalog is to match the meals. So even if your patients are NPO, you still give the basal, but you do hold the bolus. And then, most importantly, you're going to want to check the sugars 4 times a day, basically before each dose. You don't want to give insulin to someone who's hypoglycemic. And of course, if someone's hyperglycemic, you might want to give a small correction dose. Then parameters. Let's say call MD if blood sugar is less than 4 or greater than 1.8. And then we'll sign. And there we go.